What do you know about TTS, or toxic shock syndrome? TTS is not only found in females, but males can develop it as well. Everyone needs to fully understand what TTS is, the symptoms, and treatment options available. I give credit to Tampax Radiant tampons and all of the following websites that I have used to form a better understanding about TTS. The three main points that I will be talking to you about today are the symptoms of TTS, the causes of TTS, and the treatment options for TTS. First, I would like to explain what toxic shock syndrome is. Inside of any tampon box, there is a pamphlet that explains just what TTS is. It states, TTS is a rare but serious and sometimes fatal disease associated with tampon use. If you continue to read, it states about half of the cases that are associated with tampon use, the remainder occur in men, children, women who are not menstruating. Further in my research, I came across the Mayo Clinic, and on their website it says, often toxic shock syndrome results in toxins produced by Staphylococcus or staph bacteria, but the condition may also be caused by toxins produced by a group of A. streptococcus or strep bacteria. 50% of the cases are non-menstrual. However, skin wounds, surgical incisions, nasal packing, burns, or gynecological procedures can increase the risk of the condition. TTS can result in liver, lung, or heart failure. Now that you have a good idea of what TTS is, you must wonder what the symptoms may be. On the Cleveland Clinic website, it explains that the onset of symptoms is usually sudden. Symptoms of toxic shock syndrome may vary depending on the type of bacteria that are producing these toxins. The following symptoms may occur: nausea or vomiting, sudden high fever and chills, or watery and diarrhea. More noticeable symptoms on the outside of the body are of the following: a rash resembling a bad sunburn or red dots on the skin, redness in the eyes called conjunctivitis, and peeling of the skin on the soles of the feet or palms of the hands. Lastly, after hearing the awful symptoms of TTS, treatment options depend on the extent of your condition. According to the CDC, hospitalization is required. A standard treatment of shock and organ failure, such as fluid resuscitation, is imperative as the first step in the treatment. If upon arrival you are considered sepsis, which means the bacteria has entered your bloodstream and the normal chemicals in your body cannot fight the infection, the treatment of antibiotics will start immediately, in addition to the other therapies appropriate for that patient. The removal of the source of the infection may be one of the more serious treatments. If possible, it is important that the deep tissue that is infected will be surgically removed. But in most cases, the administration of penicillin are one of the most important choices in treating TTS. Now we'll review in conclusion, I have spoken about what TTS is, the symptoms of TTS, and the treatment options for TTS. I will restate again, it is very important that each of y'all know what TTS is, the symptoms and treatment options available. Men and women and children can all get this serious and possibly fatal disease I'm glad you gave me the opportunity today to talk to you about it,